do you make sure that you get diagnosed? So when we say underserved, we're not just talking about racial populations, we're also talking about groups that have been historically underserved in the United States. So recently we have seen these federal executive orders come through. And this is not political at all. I just want you all to use this as an offering to think about language. We have one executive order that says ending illegal discrimination and restoring merit-based opportunity. Ending radical and wasteful government programs, DEI programs, and preferencing. I want to read you the definition of not DEI, but of what equity means. The consistent and systematic, fair, and impartial treatment of all individuals, including individuals who have belonged to underserved communities that have been denied such treatment, such as Black, Latino, Indigenous, Native American persons, Asian, Pacific Islanders, and other persons of color, members of religious minorities, lesbian, gay, bisexual, transgender, queer persons, persons with disabilities, persons who live in rural areas, and persons otherwise adversely affected by persistent poverty and inequality. So if we're talking about getting rid of the equity of DEI, what are we really saying? So this is what we're starting to say. The ban on DEI language is radically shaping the sciences right now. What you see on the far right is a list of the words that me as a researcher who tries to write grants to the National Institutes of Health or tries to write grants for the National Science Foundation, these are words that I can no longer use. But why is it that when we look at the far right column, when I get to excluded and female and females, and we go down to the M to look for males, that's still a word that I can use. I can no longer say socioeconomic, but poverty is the biggest driver of inequality in our country. So how are we going to study that? When we're talking about being an advocate for rare disease and all the mothers and parents who are fighting to ensure their children get diagnosed, we now can't say that they're advocates? We can't say they can fight for equitable health care for their children? So how are we supposed to study the phenomenons that we're saying that are problems? Then we have these same executive orders scraping websites. So now, not me, because I'm a qualitative researcher, but some of my quantitative colleagues that are flipping numbers all day long to tell us about who has the highest rates of rare disease, who we need to impact. Well, some of those databases now don't belong anymore, and you don't have access to them yourself. Why? Because they use words that we're told that we're not allowed to use. We're also being told that these same DEI orders are also impacting how higher education and secondary education and primary education. So who's going to train our future scientists to study rare disease in underserved and underrepresented communities if we're saying that these aren't words that we can use? NIH funding freeze, applications on $1.5 billion in medical research funds. So when they froze what we think of when we hear DEI, they froze funding to active medical research. So your Mayo clinics, your Johns Hopkins, your whatever the local amazing hospital is here, immediately funds towards research are being frozen because of political dogma. NIH's drastic cut to indirect costs. Indirect cost rates is a critical threat to U.S. research. The other common finding from one of those executive orders, no longer can the NIH put on an indirect for hospitals, research institutions, clinics to charge 50 to 70% like they previously were. Now we're saying they have to charge 15%. So where are the social workers? Where are the clinical research coordinators? Where are all the people that were being paid from those indirects to be able to make sure our research continues? So all I offer is an offering, and I leave you with a quote from one of my favorite theorists, Audre Lorde, who says, "The above forms of human blindness stem from the same root, an inability to recognize the notion of difference as a dynamic human force, one which is enriching rather than threatening to the defined self when there are shared goals. When I think about rare disease, when I think about Rare Disease Day, when I think about the work that people like Lakia Nard and Melanin Children Matter are doing, it is so critical that they have our support and that we're honoring the fact that differences don't divide us, they actually bring us together. A quote from the namesake of my lab, the Leaf Lab, says, "All of us have a role to play in imagining and perhaps enacting new possibilities for a human society." For you today, that might have been buying a ticket to come to the table. For somebody else, that might be having a conversation with somebody who really believes that some of these federal executive orders are the right thing, and you saying, "Can I offer you something different?" For others of you, it might be writing a $5,000 check to Melanin Children Matter. For some others of you, it might also be just continuing to have this conversation around the kitchen table, at your churches, with your kids, because rare disease impacts all of us. There are over 7,000 rare diseases, and they impact 25 to 30 million Americans at one time. So when you start seeing cuts to our government funding, when you start seeing cuts to language that is being used, ask yourself why, and ask yourself if that's in the service for the Graysons of the world, the King Nazirs of the world, and all of the other people that are impacted by rare disease. Thank you.